opened up here, you have your diaphragm right here. Lift your diaphragm. Pretty much everything you're looking at there's liver. Setting either here, maybe a little deep, that's the gallbladder. So gallbladder, liver. Lift that, you're looking at the stomach. On the stomach, kind of hooks around. If you cut it open, you might see some of those wrinkles. Those are the gastric rugae. If your stomach's full, don't open it. They're all stretched out, you won't see them, and it's just going to be gross. But sitting right on the top here, this is the lesser omentum. So if you remember from lecture, lesser omentum kind of anchors the lesser curvature of the stomach to the inferior surface of the liver. That's part of that lesser omentum. Draping off the greater curvature of the stomach is the, well, greater omentum, which is all of this. Now, greater omentum also has kind of associated with it this, which is the spleen. So you have your liver, gallbladder, stomach, lesser omentum, greater omentum, spleen. Now I'm just going to kind of pull this, kind of fold that greater omentum up and lift, and you can see the stomach kind of jays around. Right here's the pyloric region. There's always this little depression. It's usually not green. The gallbladder broke a little bit on this, but that depression right there, that's the pyloric sphincter. And so after the stomach ends at the pyloric sphincter, the first section of the small intestine, right here, that's the duodenum. In the curvature of the duodenum, the stuff that looks like fat is actually the pancreas. And so that's the pancreas just in the inside of the curvature of that duodenum. Lift the duodenum up, kind of pull right here. Usually it's just kind of clearish, yellowish, but it's kind of green on my cat. That's the hepatic portal vein. So that's what's draining all the blood that came from the superior and inferior mesenteric arteries that were feeding the small intestines, and now it's carrying all that deoxygenated, nutrient-rich blood up to the liver so that, you know, it can run through the liver. All right. Now, if you lift that greater omentum up, we're still looking at the duodenum, and kind of here we have jejunum in there. Again, you can't tell by looking at it, the gross anatomy, but what you want to look for is this. This is the ileum. That's the last section of the small intestine plugging into the first section of the large intestine. You can see where it plugs in. There's this little pouch. That's called the cecum. So just kind of draw a line over. That's the cecum. And then the large intestine of the cat, it's kind of shaped like a J, or I guess, I don't know, whatever you want to call this, question mark. Comes up, hooks down. So if you just kind of draw imaginary lines, you have the ascending, transverse, descending colon. So it kind of goes ascending, transverse, descending. Okay. Let's kind of move everything off to the one side a smidge. Getting that stomach out of the way. And what we're looking at right here, that's the urinary bladder. So urinary bladder's right here. Going to lift that descending aspect of the large intestine. And what we're looking at right here is the vasculature. So here's the celiac artery, superior mesenteric, inferior mesenteric. Come down here, some of these pink, that's the adrenolumbar artery. There's the adrenolumbar vein running right over the top of the adrenal gland. Here's the renal vein, renal artery. And they come in, you have the kidney, you open it up, you have the renal cortex, renal medulla. The structure here is the renal pyramid, and there is the renal pelvis. Coming off of there, you have the ureter. So ureter is kind of retroperitoneal, but there it is. It runs the whole way down, and it plugs right into that urinary bladder. Now, being that this is a male cat, running right off of that renal vein, there is the spermatic vein running right down to this opening, which is the spermatic cord. Coming out of the spermatic cord and running up and around the ureter, so there's the spermatic vein, here is the vas deferens. So it comes, wraps up over, hooks into the prostate gland. So again, that's the vas deferens, spermatic vein, ureter, and spermatic cord running down. I kind of pulled back that tunica vaginalis. There's the testis, there's the epididymis. That's the beginning of the vas deferens. Now, I'm going to kind of pull everything over a little bit more. And this cat did not see very good the spermatic artery. It didn't perfuse well. Normally it would kind of run straight on over and follow that ureter down to this spermatic cord. If it was a female cat, right here you'd have the ovary, and you see the ovarian artery, and this vein would hook right on over as the ovarian vein. Inferior mesenteric, I'm going to lift all of that. One of my major landmarks is this. That is the iliolumbar artery in the veins. And here is the iliacs. So this is external iliac artery, deep femoral artery, deep femoral artery and vein, and there we go. Inside here, there's the internal iliac artery, and then super deep right there, heading straight down, that's the caudal. So it's caudal artery, internal iliac, external iliac, deep femoral, proximal caudal femoral. As far as the veins go, a little harder to see. I'm going to pull the external iliac artery out of the way. And then right here, this is common iliac vein. And it's common until you get right about over here, and if you look down in there, you can see how there's a little pipe that comes off of it, anchors it. That's the internal iliac. So it goes common, internal, external iliac vein, deep femoral vein, femoral vein, proximal caudal femoral, great saphenous. And that's it.